For a disease such as infective endocarditis, if you are asked on a random that what are the possible ways that you can be able to prevent this type of disease condition, what would be your suggestions? All right. So that was what we are looking at. Since you say this disease is actually a deadly disease and all that, we gave it all sort of bad names and all that. So we are supposed to actually still talk about possible ways of preventing this disease condition. So endocarditis, that's what? Inflammation of it could be heart valves, but mostly what? The interior of the heart muscles. Endo, inside the heart muscles. All right. So we have several prevention um, opportunity or sorry, several prevention ways for effective endocarditis. And prevention of endocarditis include is either you are trying to be careful or you are trying to now what give drugs that will help prevent the person against future infections, right? So antibiotics prophylaxis, all right. So dental procedures like what? Like if they want to do any dental procedure, if they want to operate your teeth, they should give you what? Amoxicillin, all right? Two grams of amoxicillin through the oral route of drug administration 30 to 60 minutes before the procedure. Okay, you don't want to do any respiratory tract infection because these are the infections that will now spread to infect the heart. Okay, so if they want to do any respiratory tract infection, they still give amoxicillin. Then if they want to do any gastrointestinal or genitourinary procedure or surgery, okay, they have to give what? Ampicillin. Right? They have to give ampicillin. All right, 2 grams of ampicillin, either intravenous or intramuscular, right? 30 to 60 minutes before procedure. Now, looking at the high risk group, which are the group of people in the society that are most likely to develop an infective endocarditis, right? So people already using prosthetic heart valves. All right. So let me say this is your heart. So let me say if the mitral valve is now weak, they have to now put an artificial valve. Okay. So one thing is that thing is artificial, all right, and it's actually what? Prone to infections, right? So being artificial is prone to infection. So people already using artificial valves are likely to now develop an infective endocarditis. People who have a history of a previous what? Endocarditis, previous what? Infective endocarditis, you can still what? Develop it again. That's reoccurrence. All right. Then people who have congenital heart disease can also develop this. People who have a heart transplant currently, okay, have a risk of developing infective endocarditis. All right. Then looking at the non-pharmacological prevention, we'll look at how to use drugs to prevent, right? Before any surgery, do this drug, right? So what are the non-pharmacological prevention? Practice a good oral hygiene, all right? Then regular dental checkups, safe injection practices, proper skincare, avoid piercing, okay, avoid piercings and tattoos. Why they are usually saying all this, and you see that the prevention of a disease condition that will affect the heart is talking about other places is because this infective endocarditis doesn't just jump to infect the heart. Do you understand? This is a disease condition that actually spread to the heart from other places. Okay, so if you want to prevent it, you have to take care of other places. All right. Then healthcare associated prevention. That's like a warning to health providers, right? So if they want to do any surgery for any patients, everything should be sterile. Both the techniques, everything they are using should be sterile. Okay. The proper handling of what? Prosthetic device. If you want to implant a prosthetic device into a heart, let it be sterile. Okay, because you can be implanting an infection to a patient. Okay. Then antibiotic prophylaxis for surgical procedures. Then infection control measures should also be there. Right. Patient education is important. All right. So the patient has to be what? Educated of the infective endocarditis. symptoms, the everything, okay, so that they can help prevent it better. All right. Then ask the patient to monitor their oral hygiene, total body hygiene. All right. Then ask the patient to always inform the healthcare providers if they notice any abnormalities. So that means they must know the signs and symptoms of the CVS. All right. So it's just like you're trying to put your patient into the 200 level of medical school. Do you understand? All right. Then avoid high risk activities like tattooing. All right. Then possible vaccination for influenza, pneumococcal vaccination, hepatitis B vaccination. All right. Because all these infections are infections that can actually what? Spread and infect the heart, leading to what? Infective endocarditis.